Well, the Queensland Government is considering amendments to assisted reproductive laws after some IVF patients were told their treatment couldn't go ahead. Reporter Ariana Levy is following the story from Brisbane.
Well, this is an incredibly complex story, and it started last September when legislation first passed through Parliament that required IVF providers to collect more information when it came to their donors. Now, this meant email addresses, phone numbers and full names. Some have said that that was particularly difficult when it came to overseas donors, when it came to their embryos and sperms, and those patients that already had them would mean that they no longer complied with the legislation. Now, the concern here is that it comes as a Queensland IVF patient, a woman in her 30s who had conceived her first child using a donor from a US sperm bank known as Xytex, had then looked to conceive a second biological sibling using the same donor. She was told by her clinic that that was no longer possible because they were unable to collect the relevant information needed, and that wouldn't comply with legislation. Now, days after she was told this information, that it was not possible, she then was informed by her clinic, QFG, that they could now go ahead with the transfer. She said not only was the back and forth conversations incredibly confusing and distressing, but it caused her to miss an entire treatment cycle, and it also highlighted the issues that comes with legislating an industry that largely until last September had been self-regulated. Now, the ABC can reveal that Queensland Health's Chief Medical Officer, Dr. Catherine McDougall, had written to providers last Friday telling them that the Act had never been intended to be a barrier for treatment, and also said that the continuation of cycles was simply a clinical matter. We've also heard from a spokesperson from the Health Minister, Tim Nicholls, who has said that the issues that are now arising are simply unintended consequences from the draft legislation rather than deliberate policy decisions. But given the fact that IVF has been in the spotlight most recently, many across the state are hoping the amendments made to this legislation happen sooner rather than later.